Good evening, everybody. My name's Matt Jones. I'm the CEO of Murray PHN. I'd like to welcome you to tonight's Head to Help webinar. We're very pleased and very excited about being able to share this information with you. This is a very exciting and important development for enhanced mental health capability across our catchment and specifically within the communities of Wodonga and Bendigo. I've got a presentation that I will like to go through and enable us to have not only some more information, but then some discussion around the role and contribution of the Head to Help hubs. Can I firstly start by acknowledging the traditional owners on the lands on which we all work and live. We pay our respects to their elders past, present and emerging, and extend that respect to all Aboriginal and Torres Strait Islander people. We also recognise, respect and affirm the central role played in our work by people with lived experience and their families and carers. As I said, I'm going to be providing some information about the Head to Help hubs, the process and the contributions. Before I do so, I'd also like to thank everybody for being available for tonight's webinar. It's very important that we encourage the opportunity of strengthening this investment, this addition to an enhancement to mental health capability. It will be focused on local integration. It'll be focused on how to connect at a community level, more support for those that need it. I'd really like to acknowledge and thank our partners in the Head to Help program. That's in Bendigo, that is Bendigo Community Health, and in Wodonga, it's Gateway Community Health. And on the line from Gateway, we've got representatives Andrew Brown and Karen Morrison. And from Bendigo Community Health, we've got Gerard Jose and Peter Richardson. Gerard, I might like to ask, is there anything that you might like to offer at this point?
Thank you, Matt. Really on behalf of Bendigo Community Health and I think on behalf of Gateway, we recognise the critical importance of this partnership and the Head to Help hub that will, we believe, provide a great integration with existing services, but meet the growing need amongst our communities, and particularly, I think, look at the ways that we can improve outcomes for people across the catchments, their families and their households to ensure that we really do grow a better experience for all people that may be requiring it at the moment. But I think I'd really like to pay our appreciation to Murray PHN and to the Commonwealth Government, obviously, for resourcing this new venture to ensure that really people in rural and regional areas in particular are also able to access services locally where they can. Thank you, Matt.
Thank you, Gerard. Head to Help hubs. Genesis came from the federal government on the 17th of August, where the Prime Minister Morrison announced that there will be 15 mental health hubs that will be based across Victoria that will be focusing on providing additional mental health capability of up to 7 EFT of a multidisciplinary team that will enable mental health services, particularly for people affected by the impact and influence of COVID, and enabling more services for people that are hard to reach, for people that may not have used services but are in need of mental health care. In particular, they would be based in the community, working with general practice, working with community health, working with Headspace, community-controlled health organisations, emergency departments, area mental health services and psychiatric services, and aged care. And that they would be established within 4 weeks. So where the Head to Help hubs opened on Monday, the 14th of September, in just over 3.5 weeks from that announcement. It's a really significant effort to have moved the investment in additional mental health in less than a month into translation to teams on the ground in 15 locations connected to and delivering services to our region. The presentation that I'll go through tonight will provide a bit more information around how the hubs have been established and what their role is, and there'll be an opportunity at the end of the presentation of these slides for question and answers. So I'd encourage people, where you do have questions, hopefully some of those may be answered as we go through, but please make sure that you're using the chat function as part of this webinar, and I look forward to helping provide answers to those questions. So the concept of Head to Health hubs was to offer multidisciplinary evidence-based care integrated with existing services. It was intended to be a hub-based approach with clinicians that are available in communities connected to local services. It will be a multidisciplinary team, a combination of mental health workers that includes psychologists, mental health nurses, social workers, alcohol and drug workers, Aboriginal health workers, and people with lived experience and peer workforce. Importantly, by using the primary health networks as the avenue to fund and establish these services, it would be integrated to the primary mental health stepped model of care that PHNs have delivered across Australia and in Victoria in this context. The notion was that there were to be 15 clinics, 9 in metropolitan Melbourne, 6 in regional areas, 3 per metropolitan PHN, 2 per regional PHN. So which meant we had funding for 2 in our catchment region. The funding was just under $27 million for those 15 clinics, and for additional funding to support the stepped model of care that would support the stepped up and stepped down model of care in and around those hubs and across our catchment. There was a mental health task force that was established, chaired by Professor Ruth Vine, the Deputy Chief Medical Officer, a psychiatrist with significant experience in Victoria, and Pam Anders, the CEO of Mental Health Reform Victoria. It also included a number of other representatives from Department of Health and Human Services, and a PHN representative. As I have said, the hubs are expected and were required to be connected and integrated with local services. This is around providing additional capability in the localities, but strengthening and focusing upon more services for people in needs. The concept, whilst the funding is for 12 months, the capacity is for this model to be replicated and scaled in other communities and also other states if and when funds permit. A big part of the focus is demonstrating the contribution of the Head to Help hubs in delivering the type of care that is required and has facilitated the funding for this service. There will also be a digital campaign that will be accompanying the introduction and the work of the Head to Help hubs, and there'll be a significant statewide awareness campaign commencing in October and November. In working through the locations, knowing that Murray PHN had funding for 2 hubs, and whilst that was a significant enhancement potentially for 2 communities, it also, we would have many communities that could be the potential beneficiaries and locations of hubs. We went through a process of looking at need, recognising the capacity to introduce and to enable the hub to be successful and commence from the 14th of September. We went through a range of towns across our catchment region, identified 16 that could potentially be the location of the hubs, and worked with providers in identifying the capacity that would be required to enable a team of up to 7 EFT to be quickly incorporated into existing capacity. We were really pleased through that process to identify that Bendigo and Wodonga were the locations that were best fit for what we were required to do within the timeframes, and engaging with Bendigo Community Health and Gateway Community Health enabled us to be able to utilise existing capacity and connect to a range of services that are already provided, but within an infrastructure capacity that could expand as required in short timeframes. So across Victoria, the 15 hubs in regional Victoria are located in Geelong, Ballarat, Bendigo, Wodonga, Sale and Warragul. And in metropolitan Melbourne, they're located in Wyndham Vale, Broadmeadows, Brunswick, West Heidelberg, Hawthorn, Noble Park, Cranbourne and Langwarrin. It's important to note that on the day of the announcement, the 6 PHNs in Victoria came together, developed a governance structure, a project management capacity with design teams focusing on clinical operations and implementation, data and evaluation, funding and communications, and collectively the 6 PHNs designed and developed the concept of the Head to Help hubs and introducing a range of the features that I'm going to be speaking of tonight that are across each of those 15 hubs and enabling then the localised integration that is the work that's ahead of us. Importantly, each of the hubs have a small EFT component of staffing from commencement on Monday. And our work will be on strengthening and building that team to meet the growing demands that will emerge with the communication of the focus of the service and also the capacity for referrals from providers of healthcare and also the tertiary mental health services. The approach to enable access to the Head to Help hubs is a 1-800 number, 1-800-595-212, that is available across Victoria. By ringing that number, will give access to anyone in Victoria and in the New South Wales postcodes in the Murray PHN catchment region, access into the Head to Help processes. It will firstly identify by ringing that telephone number the initial intake and assessment processes that will ensure that the services are connected to people in need, or should their needs be outside the location or outside the scope of the hub, that they're connected to the stepped model of care that primary health networks across Victoria are delivering. As I said, this is to describe that model in a different way. There will be the ability for the health provider and practitioners to refer directly to the Head to Help hub. We're encouraging people to use the telephone number. There is also online and walk-in facilities to be able to access care through the hub. It will be facilitated through an intake and assessment process through the IAR decision support tool, and it will enable then by calling the 1-800 number, the calls will be geo-routed to this relevant intake and assessment processes with each hub. There will be a warm transfer for those with clinical needs that align to the services provided by the hub. Where the services are, where the need is outside the service scope of the hubs, there'll be a warm transfer to the services within the community, or if, as I've said, if there's a need, the person that's ringing is outside the hub's location, then they'll also be connected to the local services for their needs. Through this process, it means there's a comprehensive and system-wide approach to accessing primary mental health services across Victoria. It enables the support for people irrespective of whether they have low, medium to high mental health needs. It will enable the transfer and referral for people to receive care at the right time and right place. The focus of the care provided by the hubs will be for those people seeking mental health care with moderate intensity and high intensity needs. It's the level of care 3 and level of care 4 category of patients. For those people that are ringing with self-management and low or level 1 and low intensity level 2 needs, they'll be streamed into the stepped model of care around the hubs. For those with needs higher than the ability of the hub to service, will be streamed into the acute psychiatric services within the location of the hub or in other communities. It will also enable the focus on level 3 and level 4 will enable also the management of people that are discharged from psychiatric services into the community. Referrals, as I've said, have come from the central intake provider of the hub service. There'll be a secure transfer of information with client consent for referral that is accompanied by a phone call. It will be treated as a provisional referral, and there'll be need to work through that there's no wrong door for the consumer and work through any associated issues. The behind the scenes in terms of enabling that intake and assessment process by ringing the 1800 595 212 number connects to the on the line interim central intake capacity. That then connects to, in instances where people are in the Bendigo region, to Bendigo Community Health Hub services that deliver the hub, or in Wodonga, Albury and surrounds into the Gateway Health System. I've got to the point where we've moved through all of the PowerPoint slides that we have and now got to the section of the webinar for questions. Have we got any questions that have emerged during the course of the presentation?
No, at this stage, Matt, there's no questions. Very comprehensive presentation.
Too kind, I'm not sure that's true, but here's the opportunity. If there's anybody that does have any questions, please feel free to use the chat line and the chat function. We'll be really pleased to be able to answer any questions whilst we wait for any questions that might emerge. As I said, each of the hubs have 2 clinicians that are now available. We're receiving calls and we've been making referrals to the hub services. The focus will also be not only on increasing demand and addressing the needs within our communities, but also with integration with existing services. Accompanying that focus is also the recognition that the state is making an investment of $60 million in additional mental health capacity that is going to be connected to area mental health services, and the opportunity, we hope, in working through with the state in the introduction of that additional enhancement of mental health capability will be the development of a system approach with using this approach with Head to Help hubs based in the community connected to tertiary mental health services, that the state funding, which will be obviously focusing on tertiary psychiatric services, but can then also be connected to the community. And between those enhancements of almost $90 million across Victoria, that we will have much more capacity across our system in being able to service the needs of low, medium and high intensity mental health care. And we will have integration with the primary stepped model of care across our catchment region as well. So, like many things, COVID has challenged our health system. It has also enabled or facilitated a requirement for additional investment to respond to the impact and influence of COVID. And one of the features of that response, we hope through this approach and working with the state in terms of its investment in mental health, will enable more of a systemed approach across each of our communities within the respective regions of our catchment.
What's the turnaround time for a referral from a GP right now?
So at the moment, we have introduced the service. The service started on Monday. Head to Help hubs are open during business hours. The intake processes go beyond business hours into extended hours arrangements. So I would think that there's a very quick turnaround, almost instantaneous in terms of making the referral and being connected to the system.
Can you clarify the definition of eligible referrals?
Anybody can actually ring the 1800 number and have the discussion around what their mental health needs will be. So I think in terms of eligible referrals, I think the similar process of being referred to the intake and assessment system will enable then the determination of whether the hub is able to meet the needs of the clients. So GPs and other health practitioners will have an understanding of what the health needs may be of their client, and as over time, an appreciation of the services that the hubs are providing. So I think in terms of eligibility, it's a concept that we're encouraging as many referrals for the needs, whether the hub addresses specifically the needs of the patient by providing services, or through that process connects to the stepped model of care or the psychiatric services in the region. So I think there's the definition of eligibility is quite a loose and a responsive to the practitioner deciding that they would like to make a referral.
Thank you. There's another question that Peter from Community Health has answered. How far do the hubs reach from central location? And that's a 100-kilometre bubble. A similar question, is there a catchment size for the two Murray hubs? Could patients from Benalla, Wangaratta, Yarrawonga be referred to the Wodonga hub?
One thing that we're really keen to enable is more of a regional approach to a concept of hubs that has been designed by virtue of the guidelines that require it to be community-based, where we are really keen and will be working to try and enable greater outreach and greater virtual care. So in addition to the reach of these two hubs, we will also be using additional funding that has come to Murray PHN to develop similar styled approaches in the Goulburn Valley and Northwest region. We will have capacity to structure and design those approaches with more of a regional presence in mind. In talking with the Mental Health Task Force that has overseen the development of the hubs, they recognise there's a regional context that needs also to be supported in our efforts to address mental health across Victoria. So in the first instance, having the clinicians available for face-to-face services is the arrangements associated with these hubs. Having those clinicians available within a reach, as Peter has indicated, is to some extent supported by us and the capacity to provide that, and recognising a 100-kilometre bubble to enable that to occur. We hope with additional investment in mental health, in building the capacity and scale of these approaches, that will also enable more thought and capacity for outreach and virtual care.
Okay, the next question, Matt. For patients with existing MHCP under us, needing urgent or early psychiatric assessment with moderate to severe mental health symptoms, then can we access this program?
By ringing the 1800 number, we'll give access to mental health services that are structured from level 1 through to level 5. So we would encourage people to refer into the intake processes that enable assessment and streaming into the services relevant to the needs of the person. So I think that would be the answer, Emma, is by making referral into the Head to Help hub process. It will enable access to the type of service according to the needs of the person.
Okay. Are there any age limits?
This will also be connected to Headspace, and referral into Headspace services as well will be important. Headspace provides care for 12 to 24-year-olds. So the integration with local services, with CAM services, with Headspace and the STEP model of care, I think is all part of how this service will be structured.
Where will you be drawing the extra clinical staffing component, given that recruitment and retention of high quality staff has posed challenges for many services? Is there opportunity for existing providers of mental health services in primary care to tender to provide clinical resource?
So we'll be working with Gateway and Bendigo Community Health on being able to fulfil the requirement to have a multidisciplinary team. What that will look like in terms of roles, where that's drawn from, will be very much part of building and responding to the demand. We are utilising an initial 6-week period as the 6 PHNs in our intake processes to assess the demand and the type of care that can be provided by the hubs with support of the roles. We are very keen to enable more access to a workforce that includes lived experience and a peer workforce. I've also highlighted the need for engagement of mental health nurses, psychologists, Aboriginal health workers, and also secondary consultations from psychiatrists. So I think that this is an environment that will evolve. The interest of local providers in supporting that will be very much a feature. We know the challenges of recruitment and retention in rural areas. We're hoping that this will enable greater capacity rather than changing employment arrangements of existing clinicians. And we also are hoping that it will foster the development of additional roles and capability than currently exists.
Great, thank you. Someone has made a note. There's lots of borderline personalities which are suffering in the current crisis and it's hard to engage. So I guess that's a note to pass on.
And I think certainly what we've heard from general practice that helped contribute to the identification of a need for different approaches was the fact that general practice and other primary care providers are seeing people that aren't accessing care, that are having difficulties in being able to cope and not reaching out and haven't historically been accessing care. So referral through general practice will be really important. Reaching out to areas hard to reach will be really important as well. We're hoping that this will be not just, and it won't be intended to catch the overflow from the psychiatric services, but also reach into areas where people need more care than they're currently receiving.
Yeah, okay. The next question, what services are available and are there any costs involved?
So there's no costs for the patient. There's no gap fee. This is being funded by the federal government, and so that this service, whilst it's at the moment 12 months, it is designed specifically to respond to the COVID, the emergence of additional mental health needs through COVID. The understanding of the level of demand and the needs that are being met, I think, will help assist whether it will continue funding beyond 12 months, but the way it's structured, that there aren't costs to the patient.
What disciplines are the hubs proposing or have secured?
So hopefully I've answered that in answering an earlier question. So I think it will be a multidisciplinary team, a range of different roles, a prospect of fostering new roles that may not be readily apparent, all part of our thinking in terms of the composition of the mental health team in the hubs.
And this is the last one, I think. How do you see the role of the hubs differentiating from PTS service function, given that many of the referrals will be also suitable for PTS services?
So it will be a complement to existing PTS services, particularly the CCC mental health nurse capacity. That's an area that we need more investment in. So I don't see it as a competing. I see that as a complementation and a strengthening, particularly of an area that we need more focus on level 3 and level 4 category patients. For those that are level 1, level 2, they'll be streamed into the PTS services locally and won't be serviced by these hubs.
Are there psychiatrists review, or would it be mainly counselling?
So at this stage, as I said, it is services provided by the hub with the multidisciplinary team. We want it connected to the psychiatric services provided by area mental health and psych services. The opportunity of greater integration with the increased investment in mental health will be there, but at this stage it's going to be counselling.
Suicide prevention not requiring acute care, will HUB be delivering these services, or will existing specialist PTS be extended?
Well, it's for suicide prevention. I think that it would be intended that the hub will be an avenue to enable that to occur. With some of the funding that is being provided to strengthen our stepped model of care, there's also avenues for that as well. I haven't mentioned, but it will be important to ensure that it's conveyed that this is not a crisis service, so it will be focused on suicide prevention. It isn't a 24-hour service as well, so it's not an emergency crisis service. It's very much geared around counselling for people in need, but the needs will be the level 3, level 4, and where suicide prevention aligns with that, it will be a service that the hub will be able to provide. If there's no more questions, can I thank everybody for giving your time on a busy Wednesday night, where, as I said, this has been a sprint in order to get to the point we're at now, but in many ways we're starting this process with the hub's availability to meet demand and be connected to local services. So better understanding of what those needs are, better understanding of our ability to provide the services and be integrated locally is what our focus will be for the immediate future. We really appreciate the interest that you have in discussing these issues, and we hope to be able to strengthen the work that we're doing together. I want to conclude by not only thanking you for your interest in this project, but can I also just thank everybody for your provision of care for our community during this really difficult time. Our health system has been tested like never before, and the way in which our health system has responded has been really inspiring for those of us that work with the primary care system. So can I thank everybody for all of the work that you do for our communities. It's been incredible to watch the way in which our health system has responded. So I hope everyone continues to stay safe, and we look forward to working with you in the future. Thank you.